All. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So in today's show, I don't have a lots of good news. There are things that irritated me. I'm sure some of these will bother you as well. So if you don't want a palpitation or you don't want to be anxious, just don't watch this one. And now let's start. This is a news roundup. So starting from here, of course, in the description of this video, there is a link to drbeen.com. So if you want to get access to Dr. Bean, where there are 900 beautiful medical lectures, you can go to that link, and for just a few days, you'll get access at a very low cost. Dr. Bean's library is one of the best, I think, in medical teaching, and majority of the lectures are by me. And these are mostly in addition to what you have here on YouTube. So you have these for free, plus you have more on Dr. Bean as well. Okay, so with this, starting from here, Pfizer has decided to increase their price of their vaccine by 400%. What that means is that they were offering this vaccine for 10, 11 bucks per dose. And remember, we were the taxpayers were the one who provided a lot of the budget to do the research and testing and everything and building of the vaccine system, the supply chains, or usage of those supply chains for these vaccines. And now they have decided to increase the prices by 400%. This is kind of shameful, as much as business folks sometimes do this, or mostly do this, and that is to claim that, hey, this is going to be still free because insurance is going to cover it, so free. So what about those who are not insured? So just saying that is in itself disingenuous. So this is Pfizer. So of course, if Pfizer did that, why would Moderna stay behind? And so here is Moderna, 400% price hike on COVID vaccine, consistent with the value. So I have every time when I read this, inside my head, I curse him. So Moderna is considering raising the price of its COVID-19 vaccine by over 400%, from 26 per dose to between 110 to 130 per dose. So do you know what bothers me even more is, with this budget and from these monies should come out the money to research vaccine injury. Okay, then continuing. You may remember Michelle. Remember I did this talk with her. Why was Michelle Zimmerman running into the walls? I would suggest that you watch it if you have not. It is on my YouTube channel. She is severely vaccine injured, cannot see correctly, cannot process things correctly, cognitive issues, fatigue, and many other issues. And she is disabled. A PhD person, a doctor, teacher, science teacher, interest in neurology, and here she is disabled. But she's also just relegated to the side, saying this is a rare condition. So my observation of our system here in America is, if you are on the mothership, if you are in the mainstream of the events, your disease is the kind that is mainstream disease, your needs are the kind that are mainstream needs, then you're fine. This is the best country for you. But as soon as you drop out of that mothership, you are actually left as a roadkill on the road. You're left behind. So she has been managing her situation because insurance had stopped covering her. And now the vaccine injury program is also not covering her. And this is after 400 days. So imagine being a good citizen to say, all right, I'm going to go get vaccine. Everybody's saying, go get vaccine. I'll do it. I'm a teacher. Then getting vaccine injured, then getting not recovered, using your own money to try to get the solutions, reaching out to the authorities, insurance for help or for the coverage, and insurance saying that this was really not a mandate. It was still your choice to get it. So refusing to cover. Then the federal vaccine program not covering even after 400 days. This is her situation. And I'm sure this is not just her. I'm sure there are many. I think many have just given up. For example, when it was the case of my wife's vaccine injury, I just didn't care for who covers it or not. I just went and paid out of pocket and we went from there. So I'm sure that some just are suffering. Some don't even probably know it is vaccine related. They just have been labeled as this happens, or it's psychological, or this is your age, or it happens to some people. Sorry, there is no solution for fatigue and stuff. And then there are some who may be covered because they are labeled under long COVID. And then some that are not covered and are fighting the system as well. So this was a letter in BMJ. I'm going to increase the size. This is COVID-19. Is the US compensation scheme for vaccine injuries fit for purpose? And if you see here, just some highlight that what is going on with the vaccine injury compensation. And I also have this complaint from the anti-vaccine group that they have created so much noise by calling everything vaccine, that those who are actually vaccine injured, those who actually need help, are just kind of mixed in the group and are called just conspiracy theorists and so on. So here, my toes move constantly 24 hours a day, uncontrollably back and forth, says Chris Dreisbach, a 44-year-old attorney who was admitted to hospital with debilitating neurological symptoms after a second dose of Pfizer's mRNA vaccine in March 2021. So then this article continues and says that there are two programs for vaccine injury protection or compensation. So there is a program called Vaccine Injury Compensation Program, or VICP. Then there is another program. So the VICP was established as the result of a federal law known as the National Childhood Vaccine Injury Act of 1986. Most of you are aware of it. Through this program, funded by 0.75 excise tax on each dose, this law is thought to have contributed to historically high levels of vaccine uptake in the US. It covers the majority of vaccines, including routine childhood immunization, but it is not available to people injured by COVID vaccines. So then, for the COVID vaccine, they created another program called Countermeasure Injury Compensation Program, or CICP. In my opinion, if you look at their function and the amount of compensation they've given, it almost seems like this is the under the rug department. So whoever we send to you, we will assume they have gone under the rug. That is this department. This is the rug of the health system, and you shove people who are injured under this rug and done. So check this out. Most serious injuries, so critics say that CICP is inferior to VICP in terms of its payouts and the way claims are assessed. Only the most serious injuries and death are compensated. Claims have to be made within a year after vaccination, and it has a higher burden of proof than VICP. Now, remember that other vaccines may not have generated in 1 or 2 years so much revenue that they may not be able to do compensation. So they have this program of excise taxing. per dose. Here we have contributed 2 doses to manufacturing the doses and for researches. And here they have earned trillions of dollars from this. And look at the Fed. Here is a contribution of our federal government. The loss of income under the CICP is limited to $50,000 a year, and no compensation is included for pain or emotional distress. Under the VICP, payouts for lost wages are not capped, and compensation for pain and suffering is awarded up to $250,000. So we're going to give vaccine to everyone in the country. There will be some who will be vaccine injured. Let's not give them a lot of care. The more you would see this, the more you will find out that this is a system where these vaccine injured folks fell off the mothership and there is no help. The folks who do not like vaccines, they are celebrating that, look, you decided to do it. Look what happened to you. You are a good example. Folks who are pro-vaccine, they are looking at these folks and saying, you guys are making up things and you guys are just making vaccines look bad. And the agencies are not accepting that the vaccine injury can occur because that would make people hesitant. So these poor folks, the actual injured, are just under the rug. They are on the side of a road, injured and suffering. Since 1988, compensation has been awarded in 36% of 24,909 claims filed under the VICP, with around 4.7 billion paid out. This is the VICP program. In contrast, compensation has been awarded for just 0.4% compared to 36%. 0.4% of the 7,547 claims filed under the CICP, with around 6 million paid out. So almost 1/3 of the other program, 1/3 injuries. And that program paid 4.7 billion, and this program paid 6 million. The vast majority, 93% of the claims handled by the CICP have been filed during the COVID pandemic, of which 4,097 related to injuries or death from COVID vaccine and 2,959 relate to other COVID countermeasures. This is not a very large number. You could call it rare considering billions of doses. But the question is, this is what you do? This is what we do as a society to our people who get injured? If anyone thought that there will not be injuries, then they are not medically trained or medically oriented, including medical healthcare leaderships. It was understandable. Every drug causes side effects as well. So here is an example of what we did as a society to our injured. To date, only one of the COVID claims has been deemed compensable. One. Although, so again, date of this article, although no money has been paid yet. In contrast, now check this out. Thailand's National Health Security Office reports compensating over 14,000 people, around 50 million, to settle COVID vaccine injury claims through a process that promises quick financial assistance. Thailand doing better than us. Shameful. Critics also say that the CICP is less transparent. The CICP is a horrible program, says Peter Mears, emeritus professor at George Washington University Law School in Washington, D.C. You basically submit your application for compensation. It's then dealt with secretly, and you don't have a right to have a lawyer paid by the program. You don't have a right to be to a hearing. We have no idea how these cases are being processed. There is such a lack of transparency in this program that it is frightening. And it keeps going, this article. I want to, and here is Michelle Zimmerman. I want to this article, if you go here at the top, you see here there are responses to the article. So this was the article that included Michelle. And then here is her response to this article for an update for what's happening to her. And check this out. Dear editor, so I'm not going to read all of it, just some highlights. Dear editor, successful immunization against diseases require public confidence. Confidence can only be engendered during pandemics when authorities provide accurate and timely information, establish trust through transparency, and deliver health equity, including honoring commitments to assist those harmed. CDC defines health equity as the state in which everyone has a fair and just opportunity to attain their highest level of health. CDC is just okay. So, however, all pertinent information has been disconnected from my J&J. So, in her case, she was injured by a J&J batch. The information about that J&J, because J&J stopped, information about J&J is gone as well. She cannot access anymore because that is a stopped vaccine. So her injury, she cannot bring evidence of a problem with the vaccine because vaccine documentation is stopped being disseminated because vaccine is stopped. Insurance is not covering because it was her choice to get the vaccine. Vaccine, she cannot bring evidence to the table because the vaccine documents have been stopped because government said, all right, stop J&J or not have J&J if others are available. Then, however, all pertinent information has been disconnected from J&J, my J&J COVID-19 vaccine lot number, and will not be released. CDC and FDA Freedom of Information Acts returned nothing. And yet these agencies declined to produce a letter stating that no responsive records exist. Because if she can be given that, then she can move on from there. So they have become a black hole. You fall in it, you're done. Instead, I was told my Freedom of Information Acts were sent to CBER, and I may receive a response in 24 months. Thus, I have no quality assurance or ability to show CSEP the cause of the harm. When I was reading this today, I almost thought we need a Jon Stewart to come in for vaccine injured. And there are people who are advocating for stopping the vaccines, and they are just pulling every single true or untrue claim to say vaccines are bad. I don't think they'll be able to produce enough pressure because they have become too conspiratorial. We will have to have someone who can understand goods and bads both, and then advocate for this group that is actually really damaged and fight for them. I have no quality. So in 21 months, extensive, costly, and painful medical testing ruled out all underlying conditions. After the BMJ publication, the article that I showed you, out-of-pocket costs for advanced imaging and other specialized testing confirmed that my brain damage is from vaccination. Quantitative EEGs are capturing impacts of my ongoing disability in response to physical, cognitive, and visual exertion. Now disabled, I qualify for accommodations under ADA, American with Disabilities Act. CICP, this program that is supposed to help COVID injured, CICP, designed to compensate people with severe disabilities, provides no allowance for counsel or even communication support. Then she continues, CICP gave me written assurance that action would occur by the end of the month when she filed. No action occurred in the 458 days since my filing with CICP for benefits. CICP consistently states in writing and via telephone that there is no timeline for CICP review. There is no timeline. We are reviewing. There is no timeline for us to get back to you. You have fallen off the mothership. You are under a rug. A CICP email reply dated January 5, 2023, confirmed the accuracy of the Title 42 of the Code of Federal Regulations governing public health and welfare, provides an exception to the immunity from suit or liability that the PrEP Act granted to virtually everyone involved with the manufacturing, distribution, and administration of vaccines. So Section 247D6ED3 allows, 3 is a reference, allows an alternative disposition due to exhaustion, defined as the failure to have the final determination on a request for benefits for compensation or compensation within 240 days. CSCP assigned my case number on day 460 via telephone, meeting definition of exhaustion of my administrative remedies, entitling me to pursue a federal cause of action. Safeguards and remedies must exist for those who have, like me, sustained a persistent or significant incapacity or substantial disruption of the ability to conduct normal life functions. Successful immunization programs require public confidence to be effective and quell effects of the anti-vaxxer sentiment. Policymakers must... So this is what happens in severe cases. In milder cases, people start recovering on their own. In some cases, they can afford short bursts of their needs for doctors and their fees and prescriptions. But there are people who are injured for 408 days that they've complained they were injured before. This is what Thailand did better than us. And no offense to Thailand, meaning I'm not saying Thailand is somehow lesser than us. They, of course, showed here that how much better they did. Okay, moving on. And just like I have a complaint from folks who have become too conspiratorial on the anti-vaccine side. Similarly, pro-vaccine folks who continue to make fun of anyone who was not vaccinated and got injured or died, that also is just not a very human way of behaving. Injury is occurring on both sides. If there are sides, there should not have been sides. Injuries are occurring on both sides. Death is occurring on both sides. Harm is happening on both sides. Standing and laughing at each other gives these agencies a chance to just get away with whatever. Okay, so moving on. January 9, 2023, this is JAMA, SARS-CoV-2 Omicron variant in human saliva samples in cell-free form. So this is a very interesting study. And because today is a news roundup, so I want to go from one to the next instead of just digging deeper in one study. This is a study where what they did was they took saliva samples from people who were infected. And what they did was they separated those samples in two types, cell-free and with cells, meaning with cells mean that our mouth, the surface of the mouth, the mucous membranes, and have epithelial cells or the surface cells. So when we have saliva, in that saliva, we have our epithelial cells as well. There are cells that slough off, that shed from our surfaces, and they're present in the saliva. Similarly, viruses, bacteria, other substances are also present in the saliva. Now, cell-free form of saliva or supernatant form of the saliva is where you remove the cells and all you're left with is the fluids and whatever other substances and viruses and bacteria are present. So they found in this study, they were curious that for the viral load, number one, and number two, for the aerosolization of the virus. So virus to become part of a droplet and then to move out, small aerosol, that is 5 micrometers. They wanted to see how much virus is present in the supernatant or cell-free form of saliva. And they found that they compared Delta to Wuhan and they compared Omicron to Wuhan. And they found out that in cell-free form, the Delta was less more compared to Omicron. Omicron was 17 folds more in supernatant compared to Wuhan. And I believe the Delta was 7 or so here. Viral load in the Omicron sample was 17.7 fold higher than Wuhan in cell-free forms. And viral load in the cell-free supernatant was 6.5 times higher for Delta. So Delta was compared to Wuhan 6.5 times, while Omicron was 17.7 times. What does this mean? That means Omicron produced more viral load, plus it was shedding more as well. It was traveling more. So that kind of provides you some understanding of more transmission. If you look at the whole saliva sample, in whole saliva sample, the median viral load was 15.1 fold higher in Delta compared to Wuhan, but only 7.7 fold higher in Omicron compared to Wuhan. So Delta was more high with the cells. So it was sticking to the cells more, it was present with the cells more, while Omicron was able to separate and be present more in the supernatant. So that's a very interesting study. I thought you'll like it. Then, effect of wearing glasses on risk of infection with SARS-CoV-2 in the community. I remember me talking about it as well, that the virus latches on to our mucous membranes, mouth, nose, and eyes. And so mask and the glasses are useful. This study, December 1, 2022, this study has said this in this randomized clinical trial, there were 3,771 participants. There was no statistically significant difference in the incidence of positive reported COVID-19 cases. There was a statistically significant lower self-reported incidence of respiratory infection in the intervention group, meaning those who were wearing glasses, they were just reporting more. But there was no statistically significant difference in positive COVID cases. Glasses didn't do anything. This study does not conclude that recommending the use of glasses to prevent infection with SARS-CoV-2 and other respiratory viruses is beneficial, but the intervention is worth considering because it is simple, low cost. Well, if something is simple and low cost and doesn't work, then really, I don't know what's the benefit of it. Anyways, this study shows glasses and the eye pathway they don't make any difference, or not much difference, not statistically significant difference. Okay, moving on. Okay, so Alicia says, I don't understand the Omicron and Delta part. This is why, Alicia, I normally draw. So let me explain once more the Omicron and Delta part. So imagine they have me as a test case. And what they're trying to do is they're trying to see that in me, when I get infected with Wuhan, what is the viral load present with the epithelial cells versus what is the amount of virus present in just the fluids of saliva and not the epithelial cells. Then they see when I get infected with Delta, then compared to Wuhan, how much more virus is present with the epithelial cells And how much more virus is present, more or less? Virus is present with just the supernatant, just the saliva's fluids, and no cells. So cell-free form and with cell forms. And then they said when Mubin gets, I had many infections, so you could say, although I didn't have a delta and alphas, but let's say when I get infected with Omicron, then once again they say, all right, look at his saliva with cells and without cells to see the viral loads. And what they found was there were two separate categories of results. One category was with cells. And they found, let me read it once more, in whole saliva, that is saliva with cells. The median viral load was 15.1 fold higher in Delta than Wuhan. So Delta compared to Wuhan load was 15.1 times higher, but 7.7 fold higher in Omicron. But Omicron actually produced less viral load attached to the cells, only 7 times. Delta produced 15 times. Viral load in the cell-free supernatant, so just the fluids, no cells, was only 6.5 times higher for Delta compared to Wuhan, but 17.7 fold higher for Omicron. What this means is Delta had a greater capability of producing more viruses and quickly producing a load. However, Omicron had a greater capability to become part of aerosol and go out because it was present in fluids more. More amount was in the fluids. Still produced within the epithelial cells, but just came out more and swam in the fluids more. That is what this was. I hope that clarifies it, Alicia. This is not good. Skyfrog says, also present in the post office pens. Yes, surprisingly. This one thing will shock you. And yes, that was there. Okay, so I'm distracted by the comments now. Back here. Glasses didn't know much. Then this one, I think, they say 3 weird things and the number 3rd will shock you. I think this is that shock, if you're not already shocked and dismayed and bothered. Remember bivalent booster? I was actually relaying the FDA live briefing together, and we were all watching together. Most of us, it was a 5-6 hours long transmission. We sat here, we watched it. And at one point I said that I am so bothered by one of the doctors who were saying, well, how would they earn? We have to figure out how would they do with the previously made vaccines and manufacturing. Meaning they were just, the advisors were so red carpet for the vaccine companies. And this was just such a boring FDA debrief. And I just don't know. It was just a good display of bureaucracy. And remember, I made a comment in those or a previous debrief that really what they are doing is drug companies prepared the presentations for them to display to advisors, and then advisors say done. And so it was all the work done by the drug companies. So of course, drug companies will be biased. Guess what they were biased about? This particular bivalent booster advisory committee, in here, they did not talk about infections. They instead said that we gave this booster to a few people and we looked at the antibody levels in their serum. And antibody levels were similar or better than with the monovalent booster. And based on that, the advisory committee said yes or no. And I remember Paul Offit was the one who actually said no this time. And since then, he has become very vocal about it as well. But generally, he says yes. This time he had said no, I believe, if I remember him correctly. Guess what data they didn't present? Of course, the companies didn't present in time. FDA just said, oh, they didn't give it to us in time. They gave it to us a day or so back. What was FDA's job in this world during a pandemic than to look at that data and make sure that data is carefully, completely brought for the advisory committee? They could have delayed the advisory committee's date. They had delayed for other cases as well. So they didn't delay it. And FDA said, I have not told you the data yet, but FDA said, well, we didn't get the data in time. So that is why it was not possible for us to provide it. So that means FDA and the drug companies were kind of in cahoots. Here is the data they didn't present. The data they didn't present was, and again, if you don't like CNN, you can watch it, you can read it somewhere else as well. Wherever I found something, I'm showing it from there. Nothing to do with CNN or not. The data. Okay, so here, the data called immunogenicity data was based on blood work done by on-study participants to assess how well each vaccine elicited antibodies that fight off the Omicron strain of the virus that causes COVID-19. So this was the data provided. Here is what they didn't provide. The data that was not presented to the experts looked at actual infections, who caught COVID-19 and who did not. And look at this data. It found, now this data that was not presented, it found that 1.9% of the study participants who received the original booster became infected. Among those who got the updated bivalent vaccine, the one that scientists hope would work better, a higher percentage, 3.2%, became infected. Both versions of the shots were found to be safe. 3.2% and this data was present with FDA. They didn't give it to advisors. Now, advisors are protesting that if we knew this data, we would have a different response. Some of the advisors, I'm sure not all. Some vaccine advisors to the federal government say they are disappointed and angry that government scientists and the pharmaceutical company Moderna didn't present a set of infection data on the company's new COVID-19 booster during meetings last year when the advisors discussed whether the shot should be authorized and made available to the public. The data suggested that possibility that the updated booster might not be any more effective at preventing COVID infection than the original shots. So now I'll put my position out. I have done this every single time. Expecting vaccine to prevent infection is incorrect expectation. So this fight is in general stupid. To say this booster prevented infection or this booster prevented it, that's just not the right way of looking at the vaccine. But if they were looking at it that way, which they were, then why to stop that data? And so if you see here, I was angry to find out that there was data that was relevant to our decision and that we didn't get to see, said Dr. Paul Offit, a member of the vaccine. And then decisions that are made for the public have to be made based on all available information, not just some information. And then I saw here somewhere the FDA spokesperson had said, Michael, so my apologies, Kyrie is now running around over here. Michael Fleberbaum, an FDA spokesman. Now Kyrie wants to sit in my lap, so you would see her roaming around and her tail going around because she is trying to find a place. So give me 1 second. I'll have to put blanket in my lap, otherwise she's gonna scratch me. 1 second. Okay, so Michael Felberbaum, an FDA spokesman, told CNN in an email that the FDA received the preprint less than a day prior to the advisory committee meeting, and the information was therefore not provided in an adequate time frame for it to be included in the agency's meeting materials. And generally, the FDA only discusses data at advisory committee meetings that the agency has had the opportunity to substantively review. Man, the help for you, mentorship for you will be, don't have the meeting right away. Or send that data over to the advisors and say, hey guys, we got this data, be aware of it. If you like, we can talk tomorrow. If you want to have some more time, we'll meet next week. So Mr. Michael Felberbaum, maybe you need to understand how really to operate these kind of events. Okay, so this is FDA. This is a very critical data. Immunogenicity, the blood samples, well, we gave booster and the samples had the antibodies produced. Yay, good. That is immunogenicity. They had the reverse data for booster. Booster showed the reverse effect for infection. Anyways, this is what they do. This is that study, a bivalent Omicron-containing booster vaccine against COVID-19. So if you see here, they talk about immunogenicity. We had looked into this once before. Now, still changing gears further, FDA grants accelerated approval for Alzheimer's disease treatment. So this is a very interesting one. So there is an antibody that they have approved. This antibody is called Leqembi. This is their commercial name. It is lecanemab or lecanemab. What this does is it goes in the brain tissue and binds with the A beta plaques and helps remove them. And you know that there have been many, many drugs and supplements and things that claim to do it and have not shown much efficacy. This drug has shown better efficacy. So I will do the review of the study if you like, but I wanted you to be aware. So here, Alzheimer's disease immeasurably incapacitates the lives of those who suffer from it and has devastating effects on their loved ones, said Billy Dunn, MD Director of the Office of Neurosciences in the FDA Center of the Drug Evaluation and Research. This treatment option is the latest therapy to target and affect the underlying disease process of Alzheimer's instead of only treating the symptoms of the disease. Patients receiving the treatment had significant dose and time-dependent reduction of amyloid beta plaque, with patients receiving the approved dose of lecanemab, 10 milligram per kilogram every 2 weeks, having a statistically significant reduction in brain amyloid plaque from baseline to week 79 compared to the placebo arm, which had no reduction in amyloid plaques. Then they have the labeling of the drug states that the treatment with Leqembi should be initiated in patients with mild cognitive impairment or mild dementia stage of disease, the population in which treatment was studied in clinical trials. And here is the clinical trial. All of these links are in the description as well. If you like, I can actually go deeper into the mechanism of how this study worked. We conducted an 18 months multi-center double-blinded phase 3 trial involving 50 to 90 years of age with early Alzheimer's disease, mild cognitive impairment, or mild dementia due to Alzheimer's disease. So this is a very interesting outcome. Then this is about that drug. Eisai presents full request for lecanemab phase 3. So some more data on this one. And finally, maybe we stop with a relatively better news, and that is that in where was the Ebola? I forgot the country. So the country in Africa where Ebola outbreak had started, they have declared today that the outbreak has finished. So this is the discussion. So MS says that the countermeasure compensation program is in the Department of Defense. Thank you, MS, for giving more color there. And this is the discussion. So once again, in the description of this video, so this is now my plug time. In the description of this video, there is a link for Dr. Drbeen. We are moving away from the lifetime So we are moving towards courses. For example, it is so funny. I love art. So today I signed up for a 6 week, one class a week Zoom course for art. Guess what was the price? $440, 6 classes. And we have thousands of classes here on YouTube and 900 plus medical lectures on Dr. Bean. And the price of 67 or 97, it's like 50 cents for a video. So I think I'm asking for lesser price. And it kind of makes people feel as well that this is probably not the best value. So we are changing it towards courses. So if you wanted to take advantage of it, use that link and we'll grandfather anyone who is buying now, and then we'll move towards courses. So this is the talk. Thank you very much for watching. Please like, subscribe, and share. There are links in the description if you would like to support this work. I think now it has become more and more clear that my work has a value in terms of a neutral offering instead of right side or left side and fear mongering or just gaslighting. One side is gaslighting, other side is fear mongering, and it's just not the best way. So if you would like to support this work, there are links. You can buy me a coffee, you can use PayPal, you can become member of Substack or Patreon, and we can go from there. So with this, thank you very much. I would see you tomorrow. Bye-bye.